I think you've done very well. I must commend you.
Thank you.
We've seen a couple of the things you've been doing in the States. I'll start with the first question. How prepared are you, considering the fact that two neighboring states, Benue State, we call it an incident today, and then of course yesterday we went up Enugu State. Yes. How prepared is the state?
Okay, so Cross River State is basically doing its very best. Every single day, we try to analyze the situation and see how we can improve on what we are already doing. I'm sure you know even the best of healthcare systems are in need as we speak.
Globally, yes.
So globally, it's an issue. Even the United States, at the beginning of all of this.
That takes me to my
yes.
next question. You just took it out of me. Yes, you mentioned the United States. Yeah, yesterday the American government came out and said that they want doctors.
Yes, they want doctors, they want nurses. So there's really no point where you can say I'm 100% prepared.
Assuming they say they want doctors and nurses, and the Cross River State doctors and nurses, I don't know how many you have now. How many nurses do you have on ground now? Decide to leave for the US. How will you combat this pandemic?
Well, it will be unpatriotic for our health workers to leave our country and go to the US, especially considering the fact that the health system in Nigeria is very fragile. So it's going to be very unpatriotic for health workers to abandon their post here and leave the country to go to the US. Remember, the stay in the US is just but a temporal one, and it's just for the time being. Once the intervention is over, I'm sure they'll send you right back to where you came from.
You assume that they will not want to go because they want to patriotic. But assuming they go, how prepared are you with personnel to handle this problem? How many do you have enough personnel on ground? Do you have specialists who can
We don't have enough personnel on ground.
in the States?
In the States, we don't have enough personnel on ground, and it's the same thing for the entire country. The country does not have enough health workers. WHO and indeed other reputable organizations have said that Nigeria would need 10 years to meet its medical requirements, both for doctors, nurses, and other medical personnel. So we do not have enough personnel on ground. However, it will be unpatriotic for those which we have to begin to leave the country to another country at this point of need by their own country.
But that major challenge is the issue. You mentioned personnel. We do not have yes in Nigeria, but in top of us, are we ready? Assuming we have a case, are there testing centers?
Okay, so here's the point. In the entire country, we have only 6 accredited test centers. And the federal government of Nigeria has said that states are not allowed to do their own testing by themselves. So it has to be done by NCDC in those labs, okay? And we have just 6 of them in the whole country. We have in Irua, which is the only one in southeast, and then we have in Gwagwalada, in Abuja, and then we have in Yaba, and you get. So that's the situation on ground. And for me, we have raised this at several forums that it is absolutely inadequate and too soon.
So you're saying
the burden is going to overrun them.
So you are saying in essence that if there's a case in Cross River now,
you must take samples. You can only have a suspected case. We have a protocol that will tell you exactly what you're looking out for. If people qualify to take samples based on the protocol, you take the samples and you send these samples to Irua or to Abuja or to Lagos. And then you wait for it to come back, no matter how long. Sometimes 48 hours, sometimes 72 hours. And in this particular situation now where we have a complete lockdown of different states, people are not going in, people are not coming out, it might even take up to a week to have samples come back. Remember the case of Enugu?
Yes.
That was what happened to the woman. She did not have coronavirus, okay? But then people could not confirm, they didn't know. And so they had to wait for the results from Lagos or Abuja to come back. And of course she was neglected and she lost her life just for the result to come back negative.
Okay. Now I understand your concern, your plights at this point in time as health commissioners are already concerned. The other issue on ground is the enemy. How are you guys working with the medical doctor? But at this point in time, it's for everybody, even us in the media, it's civic duty now. We're not talking about being paid for this service. How are you working with the enemy in the hospital? I'm aware they were on strike at the point in time, but they are back at work now.
Yeah, so it was really quite disturbing that at this point in time, the Nigerian Medical Association would agree to embark on a strike when the whole world is going through a pandemic, and they're supposed to stand up to the occasion and say we want to be part of this and we want to give a response. Thankfully, when the issue which they were waiting for was resolved, they came back to work. We are hopeful.
Are you working with them now? That's the question.
Basically, they are working in the health system in Cross River State, so we're working with them. Maybe it might not be on a personal level, but we're working with the NMA generally, and we're working with doctors, we're working with other associations. There's the NAM, which is the Nurses and Midwifery Association, which is also a strong one, the Medical and Health Workers Union, which is also a very strong association, even our grassroots workers who are doing lots more. These are the frontline guys, which are the other primary health care practitioners, yes, the community health workers. They're doing a lot of sensitization. They have been going through communities, encouraging the town criers to go out and sensitize our people. So we're working with the entire members of the health system to see that we can be able to offer help, care, medical care to our people if the need arises. But for now, our number one strategy remains prevention.
Good, that takes me to my next question, which is about isolation centers. How many do we have, or do we have in Nepal?
Okay, so there are 2 isolation centers in Cross River. One is at the University of Calabar Teaching Hospital, and the second one is in the General Hospital of Abuja. Those are the isolation centers.
So assuming somebody you have a case, possibly in Econ, where does he go to, Calabar or Abuja?
So based on the severity of the case, we would now decide, of course, the ambulance driver and the health workers there will use the protocol to decide which of the centers they should go to if it's very severe, because remember, it's a spectrum. It goes from asymptomatic, so people could have the virus and have no symptoms whatsoever, and it goes all the way to very severe symptoms where that can even lead to death. So we'll look at the situation. The health worker who is meeting with the client will look at the situation and immediately take a position. If it's a very severe case, it's most likely to come to Calabar, because we have specialists at the Calabar Center which can be able to attend to them.
How are equipped the centers?
Okay, so they are basically equipped, and every day when we go through the drill process, we see where the gaps are and we try to improve on them. So we had submitted a first set of equipment to them, which apparently is the list which was circulating around on social media. I had to laugh because we had donated far more than that. Okay, we had donated far more than that. That was the very first set of items which we gave, I think, about 2 months ago, and after then we've given several other things like ACs and the rest of it to bring the center up to speed. And every other day we go there. The last time we were there, we went through a drill section. I went through that session myself to be able to understand what to do in case we have a case, you get. But remember, the number one strategy is prevention. And during the drill session, we now found out that, okay, fine, there were hand sanitizers, but we needed them to be in an automated container such that you don't come in contact with it, and it will just give you the hand sanitizers without any contact. So yes, we had to get those automated hand sanitizers to provide for the center. Several other things have been seen as gaps.
I was there today.
Yes, exactly. So it's a work in progress, and that's why it's amazing when you see people go and make conclusions. We're not saying we're 100% ready, no. In fact, some of the pictures which they put out online, I share them with my colleagues in other states who are busy crying and saying that the national have not supported them and nobody has supported them, and they just tell me those things are not real, these things are not on ground, these things are not what's happening. In fact, our neighboring state had to tell me where they took the picture from and how much of a lie it is. So you see, we should be appreciative of the fact that at least we have a center, and every day we are gradually working on it to improve it from one level to the other to be able to meet the needs of Cross Riverians. Beyond that center, we have thought about several other options for isolation. including the Imperium in Tinapa.
Okay.
Exactly. When you need to isolate close to, yes.
When to a question I want to ask you that we have 100 cases in Cross River State. I think the center there, the one at UCT, I saw today.
It's not even the cases now. It's not even the cases that we're bothered about alone.
What are you bothered about?
We're also bothered about those who have come in contact with the cases that need to be quarantined.
Okay.
So beyond the noise we're making about the cases, it's more strategic. So for us as a state government, we're considering several options. You understand me? Including those Imperiums in Tinapa that can accommodate close to 10,000 people in the 4 very large Imperiums if push comes to shove. We can use those places. So these are options that are playing in our minds. And mind you, we must be very clear at this point. The federal government of Nigeria has not given any support to Cross River State yet. Good. So we are waiting for their support. And at the same time, we've not had any organization come to say, okay, we're supporting you with a pin. All the efforts that have been going on thus far has been the efforts from Cross River State, from the government of Cross River State and our partners, the University of Calabar Teaching Hospital. Okay, it's been purely that effort, and we've been trying to see how we can improve on it every other day to get care across to our people.
We're happy that we have no case yet, and we're happy that the state is more flushed on the state. But I have 2 questions and then one. The first one is, do we have ventilators?
Yes, we do. We do have ventilators.
How many ventilators do we have?
6. Well, not even 6.
But
not even 6, because we have those at the University of Calabar Teaching Hospital, which they have equally. In fact, they had I think about 2 or 4, and some of them were malfunctioning, and they've brought in persons to fix them up as part of the preparedness. We have some here. We had one in Ukem. And then we have the ones which we got from the store, which the technical person who came in from MSH said can act as both. In fact, as we speak to you now, in New York, they are calling for anything that can ventilate, anything. Even if you have an old one in your house, an anesthetic machine that has dual purpose. Yes, they said it's an anesthetic machine, and I tell them in clear terms, go and look at it. Yes, look at it, look at the manual. They have the capacity to ventilate. They have the capacity to ventilate people and keep them alive. And that's the honest truth. So it's simple. And at this point in time, I wish these people who are discussing are watching the CNN and they are following up on what is happening in the United States. They're looking for anything that can pass oxygen through people's nostrils at this point in time. But you see, we're in a paradise. And I would like to describe it as a fool's paradise, because in the entire Nigeria, we do not have even up to 200 ventilators. We don't even have up to 100 ventilators. In Abuja, Abuja does not have up to 5 ventilators. I can tell you that for free. And so when you have options that can help to keep people alive.
In clear terms, we have options that can keep people alive in clear terms.
That's what I'm saying. So this has an anesthetic component and it has a ventilating component. Of course, that's ventilating respiratory, whichever English. It's the same thing, you understand? It has both of them. It's a dual function machine. And you say at a point like this, we should abandon it when even China doesn't have to send to other countries. We've made orders for over 500, thermometers. And this, yes, the infrared thermometers. And this is 2 weeks down. They can't even come in.
That takes me to my next question. I heard that the state government, somewhere your ministry, has been selling a particular sanitizer called the accredited sanitizers.
Okay, so we are not, Cross River State government is not selling any hand sanitizers. One person, Madam Genevieve, decided to sell hand sanitizers for whatever reason. And we don't know why. And we have called her and we have cautioned that at this point in time, it is not expedient that we sell hand sanitizers. For us in the state government, we have been giving hand sanitizers free. I'm sure the transporters can tell you that for free. The market women can tell you that for free. Even the mosques, the Muslims, which we visited on Thursday to prevent them from meeting, and all of them shut down all their mosques. At least I went around Calabar and there was no mosque open. They can tell you that for free, that we gave them free hand sanitizers. Even when the transporters were asked to buy the hand sanitizers, they ran down here and we gave it to them. Okay. And we're still producing to be able to give to more persons. But what we're doing now, we're being a little more strategic. We have locked down all our borders and we are sending the hand sanitizers and the infrared thermometers to those borders. That's what they are presently packing in my office here. So they need to send them down to them so that health workers can just stay around the military and the paramilitary that are working there. In case, just in case there's one person who needs to pass, maybe he's on essential duty or he's carrying essential commodities at this point in time, they can do some form of screening for him before he comes into our borders.
I know this is not your office, but I will ask you, is there a lockdown for the state? Is there any potential plans to totally shut down economic activities in the state?
All our borders have been shut down 100% as we speak.
When you mean shut down? Cars don't come.
People are not allowed to come in anymore into our borders. It's been shut down. However, within the state, we are advising people to stay at home, and public gatherings beyond 5 persons is prohibited at this point in time.
What level of compliance?
Oh my goodness. This is one of the hardest things to do. Get people to sit at home. It's so sad. It's
That's
so
why I asked about the
yes.
lockdown. Is it a potential plan?
Yes, it is. It is. If we go through the issue of prohibiting these public gatherings above 5 and it doesn't work, we might have to x-ray it at the EOC and step it up to a complete curfew to keep people in their homes, because it's even worse for religious bodies. It's worse for religious bodies. You still see churches trying to meet. Pastors are calling me to say, look, if we space the seats in the church, can they be in the church? We are a church of about 250. I'm like, come on, I'm a Christian. I'm a child of God. I have faith. But you know, my Bible tells me that we should respect constituted authorities. And if you go against constituted authorities, you're going against a divine law. And so pastors and members of the public at this time should please shut down.
Okay, the final option, let me just ask this last one. You talk about prevention and prevention and prevention. What are the strategic plans that will mitigate against us having a case in Kosovo? Or do you think it's a case in Kosovo at this point? Do you suspect there will be a case?
Well, like I said, I do not think, and we have not seen anyone that meets the criteria.
There was a case, there was a rumor in
Ecom, we sent people there. There was also another rumor in University of Calabar. We sent our team down there. There's a new one I hear without a name. No name, no number. You see, what we begin to find out is that people just sit down, cook up hot stories, and then they just fling them into the social media, knowing that there's this panic, and so people will just propagate it everywhere, and then there's that fear. So for us, we want to tell Perseverance, let's calm down. Let's calm down. Let's take it easy. I think it's best for us to rather send messages around on how people can prevent these things, rather than us to send messages of there's a case here, there's a case here. But on the flip side, sometimes you're grateful for some things because maybe it can help more people to stay at home.